I've always been into fitness, being healthy, being able to do things for myself. I have a wife and two wonderful daughters. I'm Angel Ortiz. I live in Houston, Texas. My right hand shook a lot. My left hand, not as much. Where I would notice it mostly was at the dinner table when we were eating. If we're in a car or I have to push a button, I said, I don't know what's going on. My kids were saying, Dad, you're shaking again. Dad, you're nervous. No, I'm not nervous. For me, it was very frustrating. It got progressively worse. I tried to exercise, do some hand exercises to see if that helped. No, it didn't help. People don't understand it. Even with my family living here with them, they saw it, but they thought it was something I can control. I needed to do something, find out why this is happening, and see if there's a treatment option.
Essential tremors are a widely prevalent condition. Millions of people in the United States have this disorder. It can be treated with medicines alone, but sometimes there are patients that fail medicines, either due to side effects or lack of efficacy. So in those patients, there are surgical options. Houston Methodist is one of the first hospitals in the country and the first in the Houston region to adopt the newest focus ultrasound platform.
They're essentially doing surgery through ultrasound on a specific part of your thalamus that's responsible for the tremors. I'd like the idea that nothing had to be cut, nothing had to be put in my brain.
Hey, my friend, how are you?
Doctor, how are you?
Good to see you. With focus ultrasound, patients come into the procedure suite, into the MRI scanner. Their head is shaved completely. We place a water bath on the head, and through different sound elements, we can transmit sound waves into the brain through the skull to a precise target. The patient is awake through the entire procedure. We are able to get real-time feedback in terms of their tremor benefit, whether there are side effects, if they have any speech slurring or tingling sensations. We do whatever we can to minimize those effects during the procedure so that when they leave the MRI suite, they're left with just optimal tremor control.
So this was the first one you did when you were sitting down. This is the very last one you
Yeah,
did. So just like beginning to the end.
Oh my goodness.
There's a big difference. I mean, you can definitely see it in your name. Pretty incredible.
Yeah, it
Yeah,
is.
Mr. Ortiz.
Had a little headache from the procedure and everything, but overall, I was in shock that my essential tremors were gone. It's huge. You know, when I'm doing work, I click on what I want once, not multiple times. Eating, you know, with a fork or chopsticks or even drinking soup. It's huge. Thank you, doctor. It's been a pleasure. Thank you.
Focus ultrasound can be applied to patients that can't undergo an open procedure such as deep brain stimulation, or they do not want to have an implanted device such as electrodes into the brain or a battery under the skin. By having this focus ultrasound program in place, we were able to increase access to patients that would otherwise not pursue treatment for their essential tremor or tremor-dominant Parkinson's disease.
It's amazing. It's done in a couple of hours, and the results are life-changing. It's been life-changing to me.